The theme this year for World Hypertension Day is measure your blood pressure accurately, control it, and live longer. So the questions that I'm going to ask will be touching on various aspects of that theme. So before we get into the details, please talk to us about hypertension. What exactly is it? What do we mean when we say hypertension? And why is it considered a significant health concern across the globe?
Okay, hypertension is arbitrarily defined as a raised blood pressure. And blood pressure has two components, one when your heart contracts and one when your heart relaxes. The first one's called your systolic blood pressure, and the second one is your diastolic blood pressure. So if your blood pressure is above 140 or 90 persistently, and it's not just a once-off occasion, it's persistently, there's got to be proper diagnosis, accurate measurement of blood pressure, then you're termed hypertensive. We can argue whether that term is the correct term, because some people see that term as more as a psychiatric type of too much tension, too much anxiety, and that's not the case. You know, the most phlegmatic people have hypertension, and often anxious people don't have hypertension. If you look at South Africa, 50% of people with high blood pressure, hypertension, don't know it.
I'm glad you brought that up.
So there's a massive issue that we need to be screening more people. And 50% of people screened are undiagnosed or don't seek medical attention. And that's essentially because the vast majority, the disease is asymptomatic, the stealth killer, the silent killer. And then another 50% who seek treatment, they're not controlled. Either they're not adherent to therapy and so on. So you end up in the total population in South Africa, about 8 to 10% of people with hypertension have their blood pressure control. So there's a significant problems we face in reducing morbidity and mortality. And this has, and we published a paper showing the cost implications of untreated hypertension are enormous.
And Prof, on that point, before you move on, actually the 2 points you mentioned, that significant number of people don't know they have it, they're not screening, but even those that have screened are not managed appropriately. What seems to be the barriers, or from your experience, what do you see as some of the barriers? Because every year, World Hypertension Day is there are efforts, one can argue how successful or not they have been, to try and raise awareness, to try and make people aware of their options to screen. And in programs like ours, we also try and incentivize people to screen. But if you just think broadly, what seems to be the barriers to actually getting as many people as possible to know their numbers, and those that actually are at risk to be appropriately managed?
I think the public, in my mind, the public has difficulty in understanding the link between hypertension and outcome. It's only after they've had the event that they are now take it seriously. That's in countless times in my experience. People, I've told them they have hypertension. I recommended treatment, and they've actually said, no, I'm not taking it. Quite straightforward, even quite educated people. And so that's an extreme tragedy, and they come back 5 to 10 years later with a major stroke or whatever complication is related to hypertension. So people understand stroke, they understand heart attack, they understand kidney failure, but they don't understand this concept of hypertension, and particularly if people pay well. And often when you start treatment, if you don't do it correctly, people get more symptoms. So adherence made a big problem. Adherence is, I don't know your records in your institution, but worldwide, 2/3 of patients by 6 months are not taking their treatment. They must set a target when they, particularly when they see a physician. What should my blood pressure be? And every effort should be made to achieve that level of control.
I actually like that, yeah. And we're starting to see that quite a bit in diabetes as well, like orienting all the management efforts towards a specific goal that the patient is also aware of, because that keeps everybody honest.
Yeah, I think that's very important. And also we must be actually investing more in home blood pressure monitoring. So the people have more control of the condition, much like a glucometer.
Correct, yeah.
It must be exactly in the controlled situation of measurement. And so it becomes very helpful. Because a once-off consultation with blood pressure is like a once-off glucose reading in the consulting room. Unless it's extremely high, extremely low, it doesn't always mean too much. So if it's 145/92, now in 2024, one of the biggest cause of death and morbidity in sub-Saharan Africa is hypertension. And South Africa now has a prevalence, age-adjusted, of over 40%, one of the highest in the world. So there has been a huge change in lifestyle from extremely low sodium, high potassium diet, plenty of activity, minimal obesity, and so on. This sudden change from a high sodium, low potassium, less exercise, obesity, high carbohydrate diets. And I think it's also on top on a very vulnerable population. The genetics, in my view, that living in the sub-Saharan African environment, where salt was a scarce environment, your kidney is genetically modified, or there's genetic changes to enable you to retain sodium. And so that makes it very vulnerable to develop hypertension. That applies to all populations, but it's much greater effect in people of African descent. And so that salt is a very key issue. And we eat way too much salt. And potassium, which is present in fresh fruit and vegetables, actually ameliorates the effects of sodium. In fact, they've done a study in China where they developed a salt substitute where they made it 25% potassium chloride and 75% sodium chloride. And they did a study, and that compared with standard salt, lowered blood pressure and prevented cardiovascular events and stroke.
I am encouraged if I reflect on the work done to implement the sugar tax in South Africa. And the seeds of the work that you're mentioning in salt, that like if we continue to have professionals like yourselves and the industry at large, like we should get somewhere, because if the numbers are what you say they are, which I know that they are, we have to act.
So the other aspect is reducing refined carbohydrate, because that leads to obesity and diabetes, and hypertension is fit hand in glove. Well, type 2 diabetes, or hand in glove, which everyone is a type 2 diabetic is hypertensive. So that's another aspect is excess weight. And I mean, we ate in 1910 3 kilograms on average of sugar per year. We now, on average, I think the last one I saw 10 years ago, 85 kilograms. I mean, that's an enormous change. That's enormous. I mean, when people say 85 kilograms, that's what they ate. And it's hidden there. Like, fat-free yogurt is not sugar-free.
I think that's the unfortunate thing. I mean, you touched a little bit on food labeling, which for some people it's not as straightforward, and it can actually be misleading. And I think I saw, it was last year, a paper from the National Department of Health and some industry players that are trying to reform that space. But I think what is also unfortunate, and you also touched on it, is the available food or fast foods, they're so dense in calories, but nutrient poor as well. So even if you think you're eating one slice of like a processed food that is street food, it's so calorie dense, but it's not really helping on a nutrition perspective. So I think our food environment as a whole is really not actually helping with these stats that we're seeing.
The sad thing about these, with the high sugar content of food stuff, it actually, I mean, there's this label, sugar gives you energy. It only gives you energy for a short space. And there's a very good scientific explanation that it depletes your cells of ATP that provides you energy, because fructose in this high sugar has to be metabolized and depletes your cells of energy. So it actually makes you more lethargic, less likely to exercise, and so on and so forth. So there's a wonderful scientific explanation. Yeah.
No, I like that message, because there was an ad, I can't remember where, that was talking about sugar giving you energy, and people consume the information that they're given. So I actually appreciate that you raised that, because it's partly educating people and changing that narrative to say actually it doesn't give you energy. It's a temporary relief that you'll suffer later.
Yes.
Yeah.
Absolutely.
I really appreciate the points that you touched on, not only on explaining what hypertension is, but touching on the prevalence, the complications, the risk factors, especially the modifiable risk factors, and implications for policymakers. We'll definitely tease that through. But lastly, before we close, is there anything else that you feel you want to share that we haven't touched on, specifically around the topic of hypertension, either around how we raise awareness better, either on future research opportunities to just help us curb the burden of hypertension?
Yeah, the other very important lifestyle issue is alcohol consumption. It's a big issue in South Africa, and particularly in people who abuse alcohol. And obviously, I think we've touched on it, is exercise is really important. And that must be brisk exercise, not slow walking. Slow walking doesn't slow your blood pressure. It's got to be brisk walking most days of the week. So that's often difficult in South Africa to perform, to be honest. And I think, and the other thing I would like to emphasize, that lifestyle is really important, but equally important is medication needs to be taken in a lot of patients.